Hi, good morning, everybody. Welcome you all for the baby nursing program. My name is Manju. I'm working in Cloud in Jayanagar as a nursing in charge past 11 years. Okay, she's Sister Sheila. She's working in pediatric nurse as a senior executive. Okay, she has more than 14 years of experience in Cloud in Jayanagar. Okay, once again, welcome you all. We'll start with the session for the baby nursing program. This class is mainly for the newly couples, delivery mothers, actually. So they have a lot of query on the how to take care of the baby, how to care about their newborn child once. So this is the mainly for them, and moreover, other people also definitely can see this. There is no restriction. See, because of nowadays we are doing I mean living with a nuclear family, so everyone has like doubt. How will we take care of the baby? How will we do the bath? How will we change the diaper? How will wrap the baby? So these are a lot of confusion and doubts and like worrying about their babies. So this is mainly for them. So definitely you can watch over. If any doubt, anything, please put in the chat box. We'll answer it. Okay. Today, what and all we are going to discuss. We are going to discuss about the bath. So bath and what and all things you need to preparation that things and how to give the bath, the procedure wise. One by one we'll see that. Followed by we'll see that how to change the diaper. Okay, soiled diaper and how to put the fresh diaper and diaper advantage and disadvantage also we'll see. Okay, followed by we'll see that how to change the diaper, how to wrap the baby, how to burp the baby, and how to hold the baby. So these are the things we are going to discuss in the class today. If you're not understanding or if anything is not clarity, please put it in the chat box. We'll answer. Okay. So today we'll discuss about the bath first. So bath, there are two kind of bath, as you all aware. There are two kind of bath. One is traditional bath, and one more is tub bath. Traditional bath in the sense, in your family, your elder people, they used to give sit in the floor, they used to give by the legs. So that is called it's a traditional bath. Okay, that traditional bath also there is advantage and disadvantage. Tub bath in the sense, in your hospital when you deliver, you may see that seeing this kind of tub bath. They used to give in tub. So this also there is advantage and disadvantage. So based on your baby growth, based on your baby age, you can switch over to which bath is really necessary for you. So you can decide on this. Okay, so we'll talk about the traditional bath. Traditional bath advantage in the sense you should have elder people at your home. Then only you can perform the traditional bath. Otherwise, traditional bath is quite difficult for like as nuclear family, that father or mother cannot able to perform the bath. Okay, because they sit in the floor, they give the bath by leg. They may strip the baby down, so it's quite difficult to give kind of bath. So you should have elder people at home. They knows like already they will be aware of that how to give bath. So it's very important. Disadvantage in the sense, basically for initial days, we are not advising for the traditional bath, that too like first 1 month, because the babies have very delicate skin. What they'll give in the sense, they give prolonged bath, like long kind of bath they'll give. Okay, in the tub bath, we used to finish it within 2 minutes. But traditional bath, they give very prolonged time. They'll pour a lot of hot water on the baby. They'll pull the baby legs and hands. They'll squeeze the nipple. Because of the prolonged bath, baby may get tired. Baby so tired and go for sleep for longer period. In initial stage, baby will go for longer period. What will happen? Because of you used to advise for the mother, like mother's initial stage, that too for 15 days of the whole baby, you have to feed the baby frequently because of the jaundice stage. Okay. If you give this kind of royal bath, baby sleep for a longer period, baby may miss out feeds. Okay, once you remove the wrapper, baby will get into the fever, dehydration, sometimes the convulsions, the jaundice could have raised up, whatever the sugar level could have dropped down, hypoglycemia, that it's all complicated will be happen for initial stage. Okay, so initial stage is better to avoid for the traditional birth, but later stage definitely you can avoid it. There is no harm in that. Okay, but that is the advantage and disadvantage. For tub bath, disadvantage advantage in the sense it's very easy to give bath. Anybody can perform this kind of bath. Okay, either mother or father or like those are available at home, they can give this kind of bath. There is no restriction on this. Very easy to give bath. Disadvantage, it's very quick also. It's very quickly can do that because of traditional bath. If you have to sit and humans, it will take like more than 10 to 15 minutes. But this kind of bath, not even 2 minutes. You can finish it in very quickly. Okay. Disadvantage in the sense, baby can be slippery. Why the slippery will be happen in the sense on the newborn baby, like all over the body, the skin, there is a small vernix will be there, like under the skin. Means above the skin, there is a vernix. Vernix in the sense it's kind of creamy, kind of whitish colored thing. Okay, all soon after the birth, you may see the baby things all over the body, by head to foot. They have a varnish on the baby hair all over the body. So that will, once you adjust the water, in that means that will be leading to slippery kind of things. So you may slip into the baby to the water. So you have to hold the baby neck very firmly. Then only you can perform this kind of part. That is the disadvantage. Okay, I hope you understand what is the advantage and disadvantage. So you understand that based on your baby growth, based on your baby age, like how many months old the baby or how many days old the baby, based on that, based on your availability of the peoples, or based on the availability of the timings, you can decide about which bath can be performed for your baby. Okay, good. Okay, when you go for preparation things. No, so always make sure before the bath, what and all things you should keep ready. Once you things keep ready, only you have to come for bath. Okay, because while performing the bath, you cannot take anything in between. What will happen? People will be unattended, whether you are traditional bath and tub bath, whatever the bath can be for performing, you have to arrange the things before the bath itself. Okay. So whatever you have to want means you need to keep two wrapper, one for baby wiping, one for wrapping. Okay, you have to keep two wrapper things, preferably cotton things. Okay, diaper. Okay, for the put fresh diaper, alcohol swab to clean the umbilical cord. Okay, and whichever the shampoo you are preferring, it's good and well. Okay, then wet wipes to clean the nappy. Then fresh alcohol means the cotton swab to clean the baby eyes. So in your clean mouth, you have to keep a water also. So water should be lukewarm water. It should not be too hot. It should not be too cold. Too hot, baby skin get burned or get delicate. It will be get dehydrated again. Furthermore, too cold, baby will get into the hypothermic. Okay, that temperature level will be come down. So make sure water should not be too hot and should not be too cold. So it should be kind of lukewarm water. So before come to the procedure, we have to check the water level. Water level of this, water temperature of the level. So we have to check that. So how you are going to check? In a elbow level, how the sister is doing, the same way you have to check. It should not be too hot, as I said. It should not be too cold. The water should be kind of lukewarm water. Okay. Once your water is ready, you can perform the bath. When you're performing the bath, you have to clean your baby eyes first. Okay, clean your baby eyes first. So how you cleaning the baby eyes? You have already kept the cotton ball, right? Your fresh cotton ball. Take the cotton ball, dip into the water. Okay, dip into the water, clean the baby eyes inner to outer. Okay, only one stroke, not you have to keep on doing that. Okay, you're not supposed to do that because the baby get infection again and again. The same thing when you're using the cleaning the eyes, the same cotton should not be used for other eyes because of the eyes being infected one eyes, but you are introduced into the other not infected eyes. Okay, so make sure you have to clean with a cotton ball, only one stroke from inner to outer. Okay, inner to outer, you have to clean your baby eyes. So eyes, you have to clean the baby. Now you have to clean the baby face. Dip in the hand itself. Okay, you can touch the water and wipe out the baby face completely. Okay. Now we are going to do the full body wash. You can pour little drop of the solution, whatever your solution, baby lotion you are using, put it to the water. You can just mix it into the water itself. Slowly, when you're keeping the baby, initially, you have to keep the baby very slowly. First, the leg should be dip into the water. Once the leg and the hip sit into the water, you can just quickly pour on the water on the baby's body, all over the body. Make sure under the arm and the groins area also, just folded area also, so that you have to clean like neatly. Because of the vertex and other things will be sit over there. If you not clean properly, then again it will be infected. Okay. So clean nicely the front. Turn the baby in your hand itself. Hold the baby how sister is holding. You have to hold the neck. Definitely it's not going to hurt the baby. Okay. You have to hold the neck. One finger is the thumb finger is one side. All four fingers is other side. Okay. You have to hold the neck like that. Okay. Then turn like that and pour the water on the backside also, because of no need of putting again soap here, because of already we put the solution in this water. Okay, so put like that. Yes, your baby body bath is completed now. Now still we have to do the head bath. So in your wrapper itself, just cover with the baby and take the baby in your hand itself. When you hold it, please, this is very important. When you holding the baby, make sure you have to hold the baby ears, thumb and your center finger or index finger, however you like your baby head circumference can be accommodated. You can hold like that and cover with a ear. Okay, cover with a ear and hold like that. You can wash the head. You have kept the fresh water on the mug and you can pour the water on the face. I mean, sorry, head. So when you're pouring, don't think that it will like fall into the face. Definitely it will not fall because of your slightly you're lifting. So definitely it's not going to fall on the baby face. Okay, as well as you are here also covered with your hand itself, because of you're covered like that. Okay, you are covering and holding like that. Definitely it's not going to get inside. So your bath is over now. After the bath, you're supposed to clean the baby cord. Okay, umbilical cord. Basically, the umbilical cord will be fall 7 to 10 days. Okay, after the bath. So this 7 to 10 days, definitely you have to take care of the cord. So after bath, it will be wet, right? You have to make sure it should be clean and dry. Whenever it becomes wet, make sure it should be clean and dry. Take fresh alcohol swab, open alcohol swab. Yeah. And this also you have to clean one stroke, like circular motion. One stroke, circular motion. When you feel again it's kind of still not dry or it's still wet, take one more alcohol swab, clean one stroke. Okay, no need not to like clean and again and circular motion. Like one stroke. If you want to clean, take one more alcohol swab and clean this. When you feel if it's still clean and dry, it's really good and well. When you found it's kind of discharge, like kind of bloody discharge or smelly discharge or kind of pus discharge, okay, immediately you have to notify your pediatricians. Okay. So I hope you all understand about the bath. Okay, we have seen what is the traditional bath and tub bath and what are all things you need to prepare for the bath and how to perform the bath. So kind of step by step we have seen now. Okay, now we'll go for the diaper change. So diaper change also there are two kind of diapers. I'll just go for again. Okay, diaper also there are two kind of diaper. One is uh, disposable diaper and cloth diaper. Cloth diaper means all you are aware of that we'll cut in the triangle shape, we'll stitch, then we'll use that. Okay, as a diaper only. Then cloth diaper and disposable diaper. Disposable diaper in the sense there are lots of kind of brands are available in the market. This is strap kind of things. Okay, you have to open and stick your open this strip again stick it like that. This is strap kind of things. And nowadays there is a panty kind of things also it's available in the diaper. It's a disposable diaper. You can use it however you are comfortable. Okay, so we'll see what is the advantage and disadvantage. So disposable diaper in the sense it's really hygienic. Okay, it's very easy to put and easy to remove also. Okay, but what is the disadvantage in the sense you are creating lot of environmental waste. Okay, then moreover we are unable to count how much time baby has passed during. Because of motion, you may understand that how many times baby passed motion. Because baby passed little okay quantity of that, you may understand that baby passed. But baby passed very little quantity of the urine. You may not able to count that like how many times baby passed urine. Baby passed one or two times also you cannot able to count that because of very small quantity it should be observed into that. So you may cannot able to count that. So make sure when you're using the this kind of pad, that is a disadvantage. You cannot able to count that. Moreover, baby will get some rashes also. Okay. So advantage, baby will hygienic and baby will not get disturbance sleeping. Baby will sleep for longer period. Baby will not get the heated. Baby will feel that comfortable and sleep for the longer period. Okay. So disadvantage, that input and output cannot be able to count that because based on input only we'll see the output, right? So output we are unable to count means breastfeeding mothers, we don't know how whether the baby is taking effectively, the baby's happy with the feed or not, or baby comfortable with the feed or not, baby enough with the feed or not, we are unable to count in that. That is what I was trying to say that. Okay, cloth diaper. We'll come to the cloth. Advantage in the sense Definitely you can be able to count how many times baby passed urine in a day. Okay, or how many times baby passed motion in a day. You can definitely able to count on this. Disadvantage in the sense they will get lots of disturbance sleeping because of once the diaper is wet or cloth is wet, the baby will not sleep completely. Okay, baby will get irritant and baby will keep crying. Okay, you have to often change the diaper because of the newborn babies. Once they drinks milk or mother milk, especially, then suddenly they'll pass urine and motion. Again, then you have to change that because of, often you have to do this. Okay, that is a disturbance sleeping. They will not completely quiet with this thing, cloth. But there is advantage. You can definitely count how many times baby pass urine and motion. Okay, that is advantage, disadvantage. Now we'll see that how to change the diaper. Okay, how to remove the soiled diaper. Okay, now your baby is already with the diaper. So we'll see if baby wet the diaper, how to change that, means how to remove that. Okay. So this is what we are showing is trap kind of things. It's a sticky kind of things. That's what we are showing here. You are getting kind of panty diaper also it's available in the market. When you're using panty diaper, sideways, you have to just tear. Okay, sideways you can just tear both the side you can just tear, but remain the procedure is same. You can take down and keep it down, cleaning everything is same. Okay, if you completely remove means what will happen? Full all over the body will get dirty. Okay, so the procedure is same, but you have to tear the both the side if you're getting panty kind of diaper. Okay, this is the strap kind of thing, sticky kind of thing. We'll show how now. Okay, you have to remove the strap and stick on the same side in the diaper itself. Okay. If you forgot to stick, what will happen? If you forgot to stick, what will happen? It will be stick into the baby skin. Okay. It's a kind of Velcro there. That Velcro will stick into the baby skin means what will happen? The skin can peel that. Right? So stick on the same side. Yeah. So take the upper part of the diaper, lift the baby leg, take upper part of the diaper, just wipe it in the same diaper. Just clean it and check it. So almost the fecal matter you taken out and kept it down. Okay, because you have removed everything. So take a wet wipes. Okay, take a wet wipes. Clean upper to down. Always even eyes also inner to outer and umbilical cord also circular motion you have to clean. The diaper cleaning also you have to clean upper to down, not all means back means bottom to up. Okay, you have to clean top to bottom. You have to clean top to bottom once you can keep it in that. If you want one more wet wipes, take that clean upper to means top to bottom. If especially for the female child, don't clean like but bottom to up. What will happen? You are introducing the infection to the like vagina or urethra. You are introducing infections. Baby get urinary tract infection also. Okay, so make sure that you have to clean top to bottom. So your diaper is clean now. So you can just fold and you can keep it side. So once the bottom is completely clean, you can take fresh diaper. The strap things should become baby bottom, means back side. Yeah, the strap things, the sticky kind of things should become baby back side. Yeah, keep like that. And down part, take it and cover it with a completely up onto the belly. Okay, up to the umbilical part. And open the strap and stick it on the same side. Open this side also, opposite side, open that, stick it on the same side. Understand? Okay. Now the baby is diapered with, means put the diaper with a fit. Because once it fit and complete only, if whatever the fecal matter of baby passed motion or also, it should not be leak out. It should not be too loose, it should not be too tight. Make sure it should be fit and understand? Okay. So we have done with the baby diaper also. Now we are going to see that how to wrap the baby. So everybody's are worrying about that. How to wrap the baby. When so wrap the baby, also baby sticking out. Baby's not staying quite in that. So far, see, so far you can wrap the baby until baby kicks out. Okay. Until their own kicks out. So you can definitely wrap the baby and keep it's really better position because of once wrapped and keep, they'll feel that they'll still in the mother womb, they'll feel warmthness, they'll be so comfortably and sleep. Right? Good. So always better to take square kind of cloth napkin, means cloth, cotton. Preferably always cotton for the used to better for the newborns. Should be square type, spread over that wherever you are the flat surface. Okay, spread over any one corner of the cider, slightly fold. Any one corner of the cider, whichever you standing the side, the opposite you can fold. Because of that is easy to do that. Yeah, fold little, keep your baby head over there. Yeah, keep your baby head over there. Any one side, whether right side or left side, there is no matter for that. Now we are taking for the right side because of it's easy to do us, right? So we are taking the right side, covering with the ear. I hope you are all following that. Covering with the ear, keep the until the chest. That should be cover and keep the until the chest. Keep the right hand on the baby tummy. Yes. Take the same side, other cloth, and tuck it on the baby opposite side. Because you are taking from the right side, now you have to tuck with the left side. You have to keep means under the baby left side. You have to tuck it. See, because of this all extra cloth, right? So we have to tuck it. Okay. Now we have to take it the head, food head. Okay, take that, keep until the chest. If remaining cloth, it's supposed if big means you can just fold and keep here on until the chest. Okay, not more than that. Keep it until the chest. Then you have to the third point. The first point is the neck means head you have covered right side, and the right side hand side you have taken. The third one leg side you have taken. The fourth one you are taking the opposite head side. The left side of the head you are covering, keeping under the until the chest, and also you can keep like that because first hand you have already kept. The second hand you have to keep like that, and the same side you have to take and cover it with opposite sides. Tuck it with the opposite side. Now you are tuck it with the right side because the left side you are taking tucking with the right side. See your baby now how comfortable your baby. Okay, so once you wrap and like that, those who are not handling the baby, those who are not aware of that, how to hold the baby, also they can hold it very comfortably because you see how nicely your baby is there. So baby is now very comfortable. So once you wrap after the bath or after the baby feeds, if you wrap and keep like that, they'll sleep for a longer period because of they without disturbance they will feel happy, right? So it's a really good position. So now we'll see that how to burp the baby. So everybody has a worry, right? So newborn like mothers. So how to burp the baby, whether really mandatory to do that. So how I know that my baby is burped? So you have a lot of question on this. So when you're burping the baby, hold the baby underarm. Hold the baby underarm. Put your baby on your shoulder. Baby tummy should come on your shoulder. Okay. Baby tummy Baby tummy should compress on your shoulder. Keep your face towards when baby face also keep one side. Keep your face on the baby side like that because the baby may lift the head. Keep your head down the baby side. Okay, and slowly tap or rub. This is less than 5 minutes enough. 3 to 5 minutes is enough. Don't wait for until that whoop sound comes. Okay, because of sometimes they pass down also. But it's mandatory to do every post feed. Okay, after feed you have to do this position, whether baby's burping or not burping, no matter, but you have to do the procedure. Then only you have to put the baby in the cradle. What will happen if baby not doing the burping? Because if procedure is not doing, what will happen? They'll keep the milk in the mouth. Later, when you put the baby in the down, they may choke that. That may go to the lungs. It may get to the aspiration. It will be leading to further complications. Okay. So that is a way why you have to do the burping. It's a mandate. Okay. No need worrying further that burping stuff. Whether it comes or if the gas passing out, but either one is enough. Okay. If not happening, also don't worry. You can do the procedure and put the baby in the tub. Understand? Good. Now we'll see the holding position, how to hold the baby. The holding position also is very, very easy. Because when you're holding baby, you also feel comfortable and you also should be holding comfortably, right? This is called chest to chest. Keep the baby in your hand, between your chest. Okay, keep the baby face any one side of the disc, whether right side or left side, keep one side. Because of keep straight means what will happen? No should be stuck on here. Baby cannot breathe, that baby cannot tell you also. That's very quite difficult. Keep one baby face one side. Okay. Mothers especially, you can do this called Kangaroo mother tag, KMC. Okay. You can keep like that in your bare chest also. You can tuck it with your one towel or dupatta. You can sleep arms with the recline position. Okay. So baby will feel so comfortable whether baby kind of preterm baby or less weight baby, you can do this. Skin and skin contact will promote your breastfeeding. Okay, and it will be helpful to baby reduce the infection. There is a lot of benefits actually. You can go further. Not only mother, father also can do this. This is called KFC Kangaroo Father Care. Definitely will help to between the bondings also it will be create more. Okay, definitely can do this. It's called chest to chest and Kangaroo Mother Care. And one more position for the cradle hold. This is our way of traditional holding. This is called a cradle hold. You have to hold the baby in your arm. Head should be supported with your arm. Your palm. Baby bottom should be supported with your palm. Okay, you have to hold like that. This is called a cradle hold. This is also comfortable for baby actually. Okay. So, however, baby and you is comfortable, you can go ahead with that. We'll just summarize that session, what all we discussed. Okay, we have seen with the bath, traditional bath and tub bath. We have seen what is the advantage and disadvantage. We have seen, means we have been discussed what are the things you need to keep ready before going for bath. And we have done the procedure step by step. Eye care, face, and followed by the all over the body and the head bath. Last, we have done with the card care also. Before the procedure, you have to check the temperature of the water. Okay. Now we are done with the baby diaper change. Okay. So how to change the, how to put the fresh diaper, how to change the soiled diaper. We have done with the practical. Then we have seen what is the advantage of disposable diaper, what is the advantage of the cloth diaper, what is the disadvantage for both. This also we have discussed. And then we have seen how to wrap the baby. Then how we have done with the how to bob the baby, and how to hold the baby. So all we have been discussed today. I hope you all and we understand. Be on the line. Physiotherapist also is there on the line. She'll be take the session followed by me. So I hope you all understand. Any doubt, anything, please put in the chat box. We'll answer that. Thank you so much.
Hello everyone, myself Preeti Kulkarni. I'm your executive physiotherapist in Cloud9. To answer all your queries, we have Mohan Priya. So if you have any questions, you can note it down in chat box. Okay. So I'm here to talk about baby massage, why it is very important because it has n number of benefits for the baby, physiological as well as an emotional. As well as talking about physiological, will help in key in neurological development as we are working on so much of receptive sensory receptors. So it will help in neurological development of the baby. Coming to the musculoskeletal, it will help to increase the bone density as we will be doing so much of compression and joint mobility. And third, the gastric development, because in babies the gastric mobility is little less. So if we apply little bit of pressure, do certain movements that will help them to ease in the gastric mobility. Okay, so there are n number of questions: when to start massage, how to start massage, what is the correct time to start massage, how long should be the massage. All the questions will be answered here. You can start the massage after 7 days. So why? Because the umbilical cord will fall off and there would be no signs of infection and the area would be completely dry. So after that, you can start with the massage. Now, the very interesting question many parents do ask, which oil should I use? So before starting with the massage, make sure you do a patch test. Okay, on the baby, do not use any irritant oil which might stimulate the baby or irritate the baby. So you can use very mild oils which are suitable to the baby. If you see redness, rashes applying or after applying oil, then you need to stop the oil and change the oil. Now coming to what should be the ideal timing for the massage, morning or evening it is fine, you can start with the massage. It will take 30 minutes. Make sure you're doing post feeding 40 minutes once the baby has birthed, so that baby is not puking and not irritated. What points you should keep in mind when you're doing the massage? First thing, how should be the temperature? The ideal room temperature should be there. It should not be too cold. It should not be too hot because it might irritate the baby. It might be discomforting to the baby, and the baby won't enjoy the massage. So before exposing to the baby, make sure you have all the appliances with you. First, always expose the baby on a sheet. Do not expose it directly on a table. Baby might feel cold. Make sure that the oil is there. You have a napkin with you so that you don't have to rush and the baby is crying at that time. The other advantage for the baby, the most important advantage would be the emotional advantage. Baby will have a secure feeling, will have a social interaction faster. Female mothers do already have that because the babies are aware of the mother's smell, touch, but for the father, it is an extra advantage to bond with the baby. Whosoever is massaging, make sure that their hands are clean. You wash your hand properly. Your hand should be a little bit warm so that it gives a warmth to the baby, and make sure that your nails are trimmed so that it is not pricking the baby. After that, how should be the placement of the baby? Ideally, it should be in front of you so that you can see the baby. You can see how the baby is. Make it interactive as much as you can. Make eye contact with the baby. Always, now we'll begin with the steps of the massage. So ideally we start from lower extremity and then we move to the upper body part. Why? Because the blood circulation, the deoxygenated blood will go to the heart for purification. I'll start from the foot. So baby has the primitive reflex, which is known as plantar reflex. So they have a tendency of curling their toes. So you need to uncurl the toe. You'll start from the thumb. Gently open each and every thumb finger so that baby has a sense that we are going to start with the massage and they have the desensitization feel. Then we have two bones over here, malleolus. You are going to just use your thumb pulse and do circular motion, clockwise and anti-clockwise. For better visibility, I'll place the baby this way so that you can see uncurling the toes, taking from the heel, opening it forward and backward. Always use your pulp of thumb so that there is not excessive pressure. After that, circular motions to both the malleolus, clockwise and anti-clockwise. Now moving to the legs. There are two movements in legs, which is sulking, Swedish and Indian sulking. This will help in the blood circulation and little bit of decompression will help in the joint mobility. So the movement should be this way, rotation. I'll demonstrate on the baby. It should be Swedish sulking is towards the baby, Indian sulking is towards yourself. So that we are acting in both the directions. This is Swedish sulking towards the baby, Indian sulking away from the baby. So this was for the lower extremity. Make sure when you are grasping the baby, grasp it from your thinner side so that you have a good grasp and apply pressure from your palmar side. This way. Okay, so this was for your lower extremity. Now coming for your chest. So right now to demonstrate you, I am keeping the baby this way. There are two ends, upper chest and the gastric part. How you're going to differentiate between the two parts? You can see there would be a decompression or a dome-shaped surface hollowness in the stomach area. The area before the hollowness is known as the upper chest area. So we are going to do two movements, that is hand over hand, just taking it down. Okay, and then second would be butterfly. Starting from the midsection and then taking it away. Massaging over the chest area will help in the congestion. It will release their congestion if there is anything, and there would be a good mobility and the airway would be better. Okay, so there are the two strokes here you have to follow in chest. Now coming to the gastric movement, gastric massage. Why it is important and why we are doing for the gastric massage? First, it will help in the mobility. Baby, it would be very easy for baby to pass flatus. There would not be any accumulation of gases. So we have to start from always right and we end up to the left. Why we are end up at the left? Because our rectum is located at the left side, so that there is no difficulty in passage. So there are three strokes which you have to follow. First is the sun and moon, which would start from the right side down, coming to it, and then going to the left side. So you're going to make a circular manner. Okay. Then the second is downward movement for hand over hand, forward and backward, forward and backward. Now the third, which is very interesting, which signifies for ILU. So you will start from the left side up, take it down. This forms your I. Then you will make an inverted L, starting from your right, coming towards side, and then taking it down. And the inverted U would be starting from your right and then coming to up and then taking it down. So this was for the your chest part and for your gastric region. What you have to do. Now coming to the hand area. When you're placing the baby, it should be in front of you to explain you and keeping the baby this way. Okay, it is as simple as your lower extremity, just following the same method, but the difference would be now there would not be any massage on the palmar region. Why? Because if you must have noticed, baby has a tendency to make a fist always. Whatever action he or she is doing, they make a fist. Because this reflex is known as primitive reflex and this lasts little bit for a longer. So there is no need, if you will apply pressure, baby will automatically make a fist. So just uncurling the fingers. And as we had malleolized in lower extremity, we have here two ends, radial and ulnar head. So just circular motion this way. Clockwise, anti-clockwise. Here also we will apply a little bit of compression and distraction. So it would be like towards the baby and away from the baby, same as Swedish sulking and Indian sulking. Make sure if you see like baby is crying or if you're seeing there is rashes on baby's face or body, stop immediately. We want it to be an interactive session rather than that making baby cry or irritate. So make sure that you calm the baby, you sing some jingles, use bond with the baby, you speak with the baby. Okay. Now coming to the back. How you're going to turn the baby, the very most important question everyone asks. As baby does not have neck control, so you can hold it from the chin this way and then grasping it from the shoulder joint, as it is a very mobile joint, and then turn the baby. So in this manner, you're going to turn the baby. When you're doing a massage on back, make sure that the baby's head towards right or left, so it is not hampering the nasal passage, and the baby has enough area to breathe. So how you're gonna do the massage in back? The first starting from hand to hand. This time you're gonna apply pressure from your this side, from your little finger side, taking it down. Make sure your pressure is not too much, but it should be moderate enough so that the baby can relax. This hand over hand. And second is scooping. You're gonna scoop. So starting from your buttocks and starting from the your end of the neck and now taking it towards each other. Starting from buttocks and taking from the nape of the neck and you scoop. So your hand movement would be like this, from buttocks to your hand and together. Make sure when you are keeping your hand this way, you do not pinch the baby. It should be very gentle and just gently release the muscle. Okay. Then the next would be just sideways movement for the baby. This will release the paraspinal muscles of the baby and the baby would be relaxed. You will do this completely towards till the buttock. Okay, so this was for the extremities and back, abdomen and the upper chest. Now coming to the face. Face is the most sensitive area. So make sure when you are applying pressure, it is very, very minute and gentle. Okay, because we have lot of sensitization here. Just to explain you why we are doing in this manner, I'll explain you first how the nerves are coming here. Ideally, the origin of the nerves are in this way as 5. So we'll be doing movement away from it. So starting from the eyebrows, above the eyebrows, from the mid of the eyebrows, just apply a little bit of pressure and now take it down. So this will relax the eyeball muscles. You do this way and ending and relax. Okay. Then we'll create smile. One is creating an upper smile and the second is creating lower smile. So before starting with it, just take it towards each other and then create a smile. So this is a shorter smile, upper smile, and then coming to the lower smile, make a wide smile. So in this, the baby will eventually smile. And the most myth about is if you plug the nose, the baby will have a good nose shape. But no studies have proven that we have to plug the nose to get a better shape. So no, there is no need to plug the nose. It might block the nasal passage and the baby might have difficulty in breathing. So do not plug the nose. And make sure that you do not put oil in nose or in ears or in the orifice. Then coming to the scalp, there is no need to massage on the scalp because the scalp is very soft and very tender. It is still in developmental stage, so you won't massage the scalp. So this was for the part of the baby massage. I'll repeat once again all the steps which we did right now. So we'll always remember first, we'll start massage from the lower extremity and then we'll end at to the upper chest. Then we'll go to the abdomen part, upper chest part, back and face. In lower extremity, we'll first uncurl the toes, starting at the heel, forward movement, backward movement, thumb over thumb. Massaging the malleoli, clockwise direction and anti-clockwise direction. Coming to the legs, you'll do Swedish sulking, which is towards the baby. Indian sulking, which is away from the baby. Coming to the abdomen part. In abdomen part, you'll start always remember from the right and you'll end up to the left hand side. So making this a sun, starting from the lower part of the right side and then ending it to the left where the rectum is. Okay, so this will improve the large intestine mobility and will open the passage. Then coming to your ILU, which is I love you, starting from the right, from the left, and then taking it down. We'll make an then inverted L, starting from the right, going towards the left, and ending towards the left. Making an inverted U, then ending up to the left. Then hand over hand movement, but this time the direction would be only just towards the downside, no forward or no upward movement. Okay, now coming to the chest part, we have opening book. So from the sternum, you'll just apply a little bit of pressure with the center part, take it as a center and then Take it towards the armpit or away from the body. And the butterfly action, going it in the oblique ways. Okay. Now coming to the extremities, again you uncurl the fingers. No need to massage on the palmar side. Again, massaging over the head, radial and ulnar head, clockwise and anti-clockwise. Following again, Indian sulking towards the baby. Do not get confused between two of the stroke and Swedish sulking towards the baby. Okay, now coming to the face part, you will start from the mid part of the eyebrow and then taking it away from it. Okay, right now I am using my index finger. You can use your thumb also, but to demonstrate you, I am using my thumb index finger. Okay, so this will relax the eyeball muscles and eye muscles, then creating a smile, upper smile, and a lower smile. Okay, and coming to back, we'll place the baby. Are you going to place the baby? Holding it from the chin, make sure the head is stable, and then place the baby. Make sure to turn the head. You want to do forward and backward stroke. So in this direction, you're going to do it. Forward, backward, forward, backward. Now coming to scooping, starting from the buttocks and starting from the end of your neck. Just scoop, take it towards yourself. Scoop, take it towards yourself. Okay. Then the last would be massaging for the paraspinal muscle. Use the outer part of your thumb area and massage in outer direction. So you are releasing the paraspinal muscle, you are releasing the tension at the back muscle. Okay, so this was from my end for the baby massage. If you have any question, we have our panelist, Mohan Priya. She will answer all your questions. Thank you.